All right, everyone. So what we're going to be doing in this lecture video is talking about muscles of the head and of the neck. So like in all the muscle videos, I'm going to have the information that shows a picture of where the muscle is on the human body and or the cat, depending upon where the muscle is found. And in it, you'll have the information on the origin, insertion, and action of the muscle. I've also included information on the innervation for those who are interested in knowing that. But again, that is not information that you're responsible for knowing. As we go through these different muscles, I'll talk about, again, kind of what they're for, what they do, some things that can happen with them, like injuries and other items that show up. But again, you're responsible for knowing for every one of these muscles the origin, insertion, and action, both on the human, again, that's where we're learning it from, but also how to recognize it on the cat. All right, so our first muscle is the masseter. The masseter is a muscle that's responsible for chewing. Think like masticate, it's the same word root. So for the masseter, it's going to originate on the zygomatic arch up here, and it actually goes down then to the lateral surface of the mandible, and you have one on each side of your face. And so its main job, again, is to elevate the mandible to bring it up. Okay, so when that is relaxed, the mandible can go down, but when it's contracted, it'll elevate and bring the mandible closer to the face. And again, this is a really large muscle. The more you chew, the stronger it can get. You might have seen videos of people like chewing on that thing, and then they're like, anyway. So again, the masseter is your chewing muscle. The next muscle here is your digastric, and it works with your masseter to help you chew. So the digastric, again, you have one that kind of runs on either side here. It's going to begin, or its origin will be in the masseter region of the temporal bone. So essentially, it's going to be starting up here, kind of where your the masseter process is, so like towards the back of your head. Right? And then it's going to be inferior to the surface of the mandible. So it's going to be like underneath, so around and underneath there. And it's going to insert onto the hyoid bone, which the hyoid bone, if you remember, is the bone that kind of floats in front of your esophagus and your trachea and where your tongue attaches. And then that's going to be where it inserts. And its main function is to assist in the depression of the mandible. So again, as you bring it up and down, it's what's contracting as you're trying to bring your jaw down to open your mouth. And it also helps elevate and support the larynx so that as you're talking or moving, it helps provide the stability so your larynx isn't moving all over the place. So the myohyoid is a bone that you're going to find like in between your mandible. So if you're following like on the mental protuberance that's going down on your mandible, it's going to be covered in that area here. And you're going to actually see when we look at the cat, there is a really kind of very apparent line of connective tissue that runs in the center as these fibers kind of interweave into that actual structure there. And so for it originates on the medial surface of the mandible, so on the inside of the mandible here. And it's going to insert onto that band of tissue that runs to the hyoid bone. So it's this connective tissue you can see here that it inserts into, and then that attaches to the hyoid for stability. And so its main job or its action is to elevate the floor of the mouth, so it helps bring it up and down, again, helping with the elevation and depression of the mandible. And it helps support kind of the movement and the structures that are happening as you're talking, moving your head left and right. Again, it's helping to work synergistically with other muscles. With other muscles in that area. So the next muscle is the sternohyoid and the sternothyroid. Those are two muscles that you're going to see like right on the midline. They're going to be just sagittal to it on either side. And these muscles are responsible for neck stability, mainly just helping with the movement of your mandible, as well as providing additional structural support for other organs that are attaching in that area. And so for the sternohyoid, its name helps give you an idea of where it goes. So it's sterno referring to where it begins, which is going to be on the sternum, and actually inserts up on the hyoid bone. So it's not doing what we normally assume going from like superior to inferior. It's actually going from inferior to superior. And remember, origin is just the location where the muscle starts, and the insertion is the thing that's getting acted on. So what is that muscle pulling on? So in this case, we're inserting on the hyoid bone, and the sternohyoid is responsible for depressing the hyoid and the larynx to assist with, again, talking and making noises and all things stuff like that. For the sternothyroid, this one's really interesting because it provides support for your thyroid, the organ that's here in the front of your neck that's responsible for regulating hormones and digestion and a whole bunch of other different systems. And so with the sternothyroid, it's going to be actually lateral to your sternohyoid, so your hyoid bone being right in the middle, your sternothyroid running on either side of it. The sternothyroid, again, starts with the origin in the sternum and the rib, and it actually inserts then to the cartilage that's around your thyroid. So you have this thyroid cartilage that's here that's on the larynx. So it's actually allowing you, again, to change the shape location of your larynx and affect how your what sounds you're able to make through your voice box. And so what it does, it allows you to depress the hyoid and larynx to actually bring it down, to like move it up and down as you're moving, again changing your head location to providing support for those areas. This muscle, the sternocleidomastoid, so the reason why I have an asterisk here is that this muscle in the human is actually one muscle, but in the cats, when we look at them, they're going to actually have two separate muscles that form kind of the same structure. So for the sternocleidomastoid, its origin is going to be in the sternum, and the cleido referring to your clavicle. So it begins there, and it inserts on the mastoid region of your skull. So again, sternocleido, here in this part, again, your sternum, your clavicle, and it inserts on the mastoid process of your skull. And so with that one, when you're thinking about its action, you have one on each side of the face. And depending upon how you fire those, if you fire one of them, it's going to rotate your head to the left or to the right, depending upon which one you're interacting with. Or if you work on both of them at the same time, it's going to allow you to flex at the neck, so decrease the angle between your chin and your sternum. Okay? And so depending upon how you utilize that and what kinds of things you are pulling on that one, that muscle will, again, change the location of your face going on either side. Again, for humans, we have one muscle that serves as kind of a synergistic pull of those two things, the sternocleidomastoid. In other animals and other mammals, you'll see it actually split into two separate muscles because the origin is different because of the way that the sternum and the clavicle are structured. In humans, they're stuck together. There's that gliding joint that holds them and supports them, so we have a really strong support up here. But in other animals, it's actually loose, and it just kind of floats there. So their cleidomastoid is actually separate from their sternomastoid, in order to make it so that they're able to have more flexibility in that upper front, or the upper part of their trunk. So let's talk now about muscles of the chest. And so when we're talking about muscles of the chest here, we're interested in talking about the superficial kind of and the anterior muscles of this. So the muscles of the chest, they can go down pretty deep, and we'll go through some of those deeper muscles here. But again, when we're looking at the cat and we're looking at models and examples of the human body, these are the muscles that you're going to see in the front that are very apparent. Right? These are the ones that do kind of most of the work. And there are lots of other supporting muscles that are in that area, but again, we're not super interested in those. We're looking at like the big heavy hitters in terms of motion. All right, so the first muscle that's here is one that we will not see on the cat. It's not easily visible, mainly because we end up removing it as part of our dissection process. But it's the sheet-like muscle that comes from the lower part of your jaw here all the way down to the front of your sternum. Okay? And this is like what you can tense if you like think about like gritting your neck or something like that. But the platysma, this muscle, again, it originates from the cartilage of the second rib, so kind of down here in the second rib, all the way up to the acromion process of the scapula, so kind of around that area here. And then it inserts up on the mandible and into the skin of the cheek. So it actually inserts here into that skin that's there. And so its main job is to actually allow for tension in the skin around our necks. And you'll see this, like as people get older, they'll have more folds and things like that around their necks because this muscle gets weaker over time. So again, you have less ability to hold that tissue fully together and taut. But as you get older, collagen and stuff starts to break down and it just starts getting weaker. But its other action that it's responsible for is helping with the depression of the mandible. It's what's allowing it to kind of, again, get pulled down to that last little bit so you can really open your mouth wider. And again, with the platysma, it's a muscle that you'll need to know in the human. It'll be one I'll ask questions about, like, here's the platysma. What's its origin? Or without it actually being something you can see on the cat. But you should know what region it's in, again, around the side of the neck, that it's pretty superficial. And again, that it's going up into the jaw here to help with depression of the mandible. The next two muscles, the pectoralis major and minor, the way that they look on the cat is the exact opposite of how they look in a human. So you'll have to keep that in mind as we're learning them on the cat, is that the larger muscle doesn't mean that it's necessarily the major muscle. Remember that as we're identifying names and muscles on the cats, we use the human names to define those on the cat. So structurally, they'll have the same origin, insertion, and action, but their sizes may be different. So the pectoralis major in a cat is actually really small compared to the pectoralis major in a human. So for the pectoralis major, its origin is going to be on the cartilage of the ribs, 2 through 6. So think like, where is your pec muscle going to be? So starting like below the clavicle and then those first 6 ribs. So kind of just, again, where the true ribs are on the side of your sternum. So going from that part of your sternum, they're going to actually insert over onto your humerus. So if you think about people who are trying to do chest presses and things to build up their pectoralis muscles, right? A lot of those require you to then push and pull and lift weights kind of going forward or out. So if you're like leaning back and you're pushing it up, right, you're actually working that muscle by forcing it to press on your chest and allow you to push it upward. So with that one, when you're thinking about its actions, it can actually do quite a bit. There's a pretty large range of motion that the pectoralis major is capable of performing. But a lot of those deal with, again, flexion and rotation at the shoulder. So when we're thinking about flexion, it's bringing it in. Right? When we're thinking about adduction, again, you're pulling out your arms out here and you're bringing those in. That's a responsibility of bringing the humerus closer to the body, right, to the midline. And then you have medial rotation of the shoulder. So if you can continue to contract that, you'll rotate the shoulder over. You'll be pulling on this part of the humerus here so that it actually rotates into the front of the body. The pectoralis minor in cats is big. It's the large one in the cat. But in humans, it's actually a smaller muscle that's deep to the pectoralis major. We're not going to see it on, it's not a superficial muscle, unlike on the cat where you do see it and it is a very superficial muscle. But for the pectoralis minor, it's going to originate on the surfaces of ribs 3, 4, and 5. Right? And it's a small muscle that goes up to the coracoid process of the scapula. And so again, its main job is to help with the movement of the shoulder and actually rotation of the scapula. So if you say are doing abduction at your shoulder, right, your pectoralis minor is what is bringing it in, but then when you add to it, it's what's allowing you to bring that part of your scapula forward. So if you do a slow motion here, you can actually feel and you like compress where here's your clavicle going forward, and then underneath your arm is where you're going to have the pectoralis minor go. And so you can feel that as you raise your arm up and down, that muscle is contracting and kind of again deepen underneath your pectoralis major. Okay? And so this can also help elevate the ribs and help expand that area. So if you keep your scapula stationary and don't move it, it can actually then pull on the rib and actually like help expand it when you're breathing. So if you're like breathing really intensely and you like bend over, right, you're actually keeping your scapula staying in the same place, right, with your arms like firmly on your hips. And then that allows that muscle to work to actually expand so you can get more air into your chest. The next muscle that's here is the xiphi humerales. This is one of the several muscles that are cat only. But the reason why we look at these is because it's important to understand that, like, yes, structurally there's going to be some differences between the human and the cat, and that you need to be able to recognize those differences so you don't get confused on different muscles. Again, as we're learning these muscles, it's really important to remember that the origin, insertion, and action for all of these muscles will be the same, and that using the cats as your study tool is the paramount way to study this stuff, because you're going to be asked to describe them on the cat. So knowing how they look there is really important. So knowing which ones are cat only is helpful as you're studying and trying to reflect on other features and characteristics moving forward. So for the xiphi humerales, if you think about its name, xiphi referring to the xiphoid process of the sternum, that's where it's going to begin, its origin. So if you look here on this image, it's going to be at the very bottom of the sternum. And then it's going to insert on the proximal end of the humerus. So it actually goes up and around to this part of the humerus up here. And so we humans, we have, we don't necessarily need this muscle to do that support because we have a very large pectoralis major. But again, this is a muscle that helps adduct the forearms, bring it in. And in cats, because they need to like have that flexible shoulder, they need that extra muscle support to make sure that they can bring it in and provide stability, since they don't have the connection that happens between the clavicle and the sternum that we as humans do. So again, xiphoid process of the sternum is the origin. It inserts on the proximal end of the humerus, and its action is to adduct the forelimbs, or to bring in the arms. The other muscle that we'll see on the cat that's important, again, just kind of as a landmark to help us understand the locations of different muscles in the cat, is the pectoantebrachialis. So pecto referring to the pectoral region, ante being before, and brachialis referring to the arm. So this is the muscle before the arm. So where it inserts is at the top part of the manubrium, so the head of the sternum. And it'll insert into the fascia of the forelimb that goes below the elbow. So it actually goes all the way across the cat. So if we're thinking about its arms out here, it starts in the center and it goes all the way outward. And its main job, again, is to help with that adduction and rotation of the forelimb to bring it closer to the chest. Again, cats need that extra muscular support because they don't have that, that structure with their clavicle. The next set of muscles, the external and internal intercostalis muscles, or intercostal muscles, those muscles are responsible for helping us breathe. Their main job is to contract and relax and pull on each other to expand and contract the chest cavity so that you're able to create more space for your lungs to inflate, or to decrease the space so that your lungs will deflate. As you change that pressure inside of the cavity is what it allows you to bring air in and out as part of the breathing process. So with the external intercostals, these are going to be like, we will dissect down to the ribs and we'll actually see the bones. And these will be the muscles that are most superficial in that area. Okay. Generally with their fibers, when you're trying to remember the origin insertion, is that remember with these, they actually run from bottom to top. Okay, so you're actually starting, or sorry, from top to bottom, and that you're starting from the rib below, the bottom of that rib, and inserting into the top of the next rib. So it begins on the inferior border of the rib above, and it's going to insert on the superior border of the rib below. And again, its main job is to elevate the ribs. And by elevating, again, we're expanding and we're breaking it, making it larger. The internal intercostals, the fibers run in the opposite direction. So before, we had an origin on the inferior border of each of the ribs for external. For the internal, our origin is going to be on the superior border of each rib, and we're going to insert into the inferior border of the rib below. So, or rib above, sorry, the preceding rib. So the way it's going to work is essentially one is going down this way, kind of like turn. The other one is going the opposite direction below it. And so as one depresses and pulls, it's going to shrink the size of the cavity, and other ones, as it expands and this pulls, it's going to bring it outward and increase the cavity. So it changes the overall volume of your chest. Another muscle that we'll see a little bit later as well, it's kind of a weird one in that it's both like a anterior muscle and a posterior muscle, is the serratus anterior. So the serratus anterior is a muscle that's going to attach to the anterior and superior borders of all of your ribs and actually inserts back onto the scapula on the anterior surface. So it goes like all the way under and around to that vertebral border. So like on the far side of your scapula here, below it. And what its main job is to help you do is to protract the shoulders and adduct. So it actually helps you, again, like elevate and raise this upwards. So as you're bringing it in and down, that's your serratus anterior that's allowing you to do some of that rotation. The serratus anterior, when we look at it and why it's called serratus, is that it has this kind of edge that looks like the end of like a serrated knife, where you have these like sharp points and valleys that go the entire length of the rib, well, or at least for ribs 1 through 9. And so we'll see that when we do our dissection. It's a much deeper muscle compared to the other ones, but it's important to look at in reference to how your shoulder works and how those muscles move. So we'll look at that one as well. So I'm going to stop there. Again, those are the muscles of the head and neck and the ones that you're responsible for knowing. Again, as you're learning these muscles, remember that you need to know the origin, insertion, and action of each of these. And then I'm looking for you to be able to accurately describe parts of those for every single one of these muscles.